We have 2231 cases of coronavirus in Victoria. That's plus 73 on yesterday. 3 from hotel quarantine, 9 that are associated with known and contained outbreaks, 19 as a result of routine testing, and 42 that remain under investigation by our public health team. We did 20,682 tests yesterday, so I'll take this opportunity to thank every single one of those, going on for 21,000 people who presented for a test. Thank you so much. That's such a powerful contribution to our fight against this virus. That brings our cumulative total since January 1 to 830,271 tests. In terms of the overall testing during this concentrated suburban testing blitz, which has been primarily focused on those hotspots that we all know about, that's 113,000 tests, and again, I'm deeply grateful to each and every person who has consented to a test. It really is a great and significant contribution for your family, and a significant contribution for every single Victorian family. As you know, community engagement, old-fashioned door knocking has been a really important part of our strategy to get into these hotspot communities and to get the message out, to be recruiting people into that testing program literally on their doorstep. I can report to you that as of last night, we had knocked on some 54,000 doors in those high-risk suburbs and postcodes, offering advice, testing information, and in some cases the self-administering test kits where people can take the test and it can be collected at a later point. There will be further door knocking, quite intensive door knocking, and there'll be an update to this end each and every day. But just to give you a sense of where the next priority areas are, there'll be further extensive door knocking in Maidstone, continued door knocking in Broadmeadows and Auburn Vale tomorrow, and Brunswick, today, and Brunswick West on Thursday. And that just adds to the program, that rolling program of door knocking that we have been engaged in and will continue to be engaged in for the weeks and months ahead. Jenny will speak to additional test sites, but this is a really important point, and we'd be very grateful to you if you can help us to get the message out about additional test sites. We're trying to get to a situation where, in a combination of mobile testing, so end of your street, literally on your doorstep, as well as additional drive-throughs and other pop-up clinics, there will be 12 new sites that'll be dedicated testing locations across all of those postcodes that have been locked down from midnight tonight. There are, and I think we've got 6 of those we can announce for you today, and again, we'd be very grateful if you can help to get that message out. Essentially, we really just need to impress upon all Victorians that this is not over. It won't be over for a long time. And the best and most important thing that we can all do, whether we're in one of these hotspot postcodes or not, is to follow the rules. Again, they're very simple. Keeping your distance, staying at home if you're sick, getting tested if you're sick, making sure that you cough into the crook of your arm, making sure that you wash your hands regularly. These are simple things, but they make a massive difference to the fight against this virus. They make a massive difference to us putting out this public health bushfire. In terms of those lockdown suburbs, I again make the point, I know and understand that this will be deeply inconvenient, it'll be frustrating, it'll be very challenging. We will be there to support each and every business that's impacted, not just within the zone, but also, for instance, as I referred to yesterday, those tourism businesses where there will be bookings that'll have to be cancelled because of these lockdowns. Martin Pakula, in his ministerial capability, will make some further announcements quite soon about that package of important support to families across those lockdown suburbs. If we all work together and if we all stick together over these next 4 weeks, we can regain control of community transmission. We can again have control of the virus across metropolitan Melbourne, because the source, where it is most acute, where it is most unstable and therefore highest risk, is in those postcodes. That's the advice of the Chief Health Officer. I appeal to all of those families, follow the rules, do the right thing. If you need support, we'll get that support to you, and we'll have more to say about that in coming days as well. But ultimately, if I didn't shut down those postcodes, I'd be shutting down all postcodes. And I don't think we want to get to that point. We all want to work hard, literally day and night, to try and avoid that sort of an outcome. I'm confident, because the public health team are confident, that this strategy of lockdown, just as it worked the last time we did it, albeit across the state, will again be successful in pulling this thing up. That's the most important thing we have to all focus on, and that's exactly what we are focused on. To talk more about those additional testing sites, which are critically important, and just to again reiterate how important it is to get tested if you're sick, and how grateful we all are for those who have come forward in now unprecedented numbers. Another day in excess of 20,000 is exactly what we need. I will just say that there are a whole range of resources coming from other states. Some of those are virtual, if you like, so there's calls being made, contact tracing out of, say, Sydney, that those personnel don't need to be here, but there are lots of other personnel, and I've spoken with the Premiers of New South Wales, South Australia and Queensland overnight, and thank them very much on behalf of all Victorians for the, just like fires and floods, we're all working together, because we all know this to be not just a northern Melbourne issue. This is a Victorian and a national issue, and I'm very, very grateful to all of them. I'm also very grateful, as I explained yesterday, to the Prime Minister. I had a few texts with him last night. He's, I think, very pleased with the announcements we made yesterday as the appropriate response, and we'll continue to work with him and his officials and his ministers to make sure that whatever we need, we will get. That's been the record, that's the form, in terms of the important partnership we have, and I don't see that changing, and for that I am deeply grateful to the Prime Minister, and I'll continue to keep you informed of different teams of people, different specialists, different capability that will be coming to Victoria to help us in this fight. To talk about the expansion of test sites, I'll now hand over to Jenny, and then we're happy to take any questions you have.
Thank you, Premier, and good morning. Obviously, the legal directions are being completed as we speak, and they will be publicised very soon. That will start from 11:59 p.m. But testing, tracing, isolating cases is a key part of our response to this continued pandemic. We are making it much easier for individuals, for families living in those restricted postcodes to be tested than ever before. So in addition to the 22 existing testing sites that are available in or close to those restricted postcodes, we are in the process of opening at least 12 additional testing locations in those communities, and about 10 of them will be available from later today. So they are the Wingate Avenue Community Centre, the Maribyrnong Community Centre, Fairburn Park Pavilion in Ascot Vale, Nidri Community Hub, Glenroy Library and AG Gillen Oval. So they will be open from this afternoon. We're also putting in place a number of mobile testing locations into these restricted postcodes as well, and they will be available from later today at the Global Learning Village in Broadmeadows, at the Fawkner Basketball Courts in Fawkner, at Auburn Vale Community Centre, and at the Maidstone Community Centre. So we will also have further locations opening later in this week, and we'll be publicising those and sharing them with you as they become available. We're also sending mobile testing units very soon in the next few days to Reservoir and Sunshine. They were part of the original hotspot suburbs, so there will be continued activity, not just in these restricted postcodes but in other suburbs where we've had concerns in recent days and weeks, and making more testing opportunities available for those communities. I just want to take this opportunity to express my thanks to my interstate Health Minister counterparts who have been very supportive and very helpful in our joint efforts to respond to these issues, and we're grateful for the nursing support and other clinical supports that we'll be receiving. 30 clinical staff coming from South Australia, as well as 40 nurses coming from the Queensland Government, very grateful for a number of jurisdictions, New South Wales, Queensland, WA, and South Australia, Tassie, all assisting us with additional contact tracing capacity as well as pathology support. We have been putting in place additional contact tracing resources into our team. We're at about 1,400 now, and we'll be expanding to 1,600. And with the additional support we're getting from Interstate, we are well placed to be able to respond to any additional contact tracing needs as we go forward. So my final comment today is to say to the 300-odd thousand individuals living in those restricted postcodes, we are making it much easier for you to be tested. Please get tested regardless of whether you have symptoms. This is important for your safety and the safety of the rest of our state. Thank you.
So just before taking questions, can I just make the point that there are literally thousands of people out there door knocking, taking tests, processing tests, thousands of people doing contact tracing day and night. There is such a big team of people who are working as hard as they possibly can to try and pull this thing up, to try and, again, have control of this virus. The key point, though, is that they alone won't be enough to achieve that outcome unless communities work with us, families, individuals work with us. There are rules. They're there for no other reason than the safety of every Victorian and moving to that point where we can again resume opening up. That's what we all want to achieve. I don't want to have to shut down any more postcodes. That is less likely if Victorians follow the rules. If Victorians who are sick get tested, if Victorians who are sick don't go and visit friends, don't go to work, don't continue as if they weren't ill. We all want this to be over. We all know and understand that, but we can't pretend that it is, because it is not. And the wildly infectious nature of this virus means that we've got to take these steps. It is challenging, heartbreaking, it's very, very difficult, but these are the appropriate public health measures. That's the advice from the experts, and that's why we've made these very tough calls. But to take any questions you have.
73 today, are they
yes.
in these postcodes?
Not exclusively rich, but there is still a significant concentration of new cases in those hotspots, so that trend continues. I'll need to get, with so many cases still being investigated, I think the public health team's release, media release later on today will provide you with some further details on that. But we're still seeing, the briefing I had only moments ago is that we're still seeing, and throughout the morning I should say, we're still seeing a really significant concentration in those hotspots. That's a trend that is holding up, and that's not surprising given the amount of testing we're doing and the fact that we've located those as the most unstable, the most high-risk areas. Can I just make the point though, and again, every day presents its own challenges and no one can predict what tomorrow's numbers will be, but it is pleasing that there is some sense of stability to these numbers. We are looking in unprecedented ways. We are finding new cases, but there is the beginnings of some consistency here, and that is obviously better than other options where we might see doubling and doubling again. It is exactly why we've taken this course of action. We've made these decisions, taken these very difficult steps, because it is in the judgment of our public health team exactly what is required to bring some stability back to these numbers and then steadily drive those numbers down.
Premier, why was the decision made to judge it on postcodes rather than individual suburbs? We're hearing from people in suburbs where they've had 0 cases, but because they're in a particular postcode, they're now under lockdown.
Well, let's be very clear about this. The decisions about where these lockdowns would be applied is a matter of public health. It's not as if I sat down with a map and drew these boundaries. They've been drawn by our public health experts based on data. The other thing here too, this is a legally enforceable lockdown and you need to have the most certain lines on the map. People know which postcode they live in. There can be no confusion about that. What's more, there are hard lines that are well known and well understood, and for the purposes of enforcement, the public health team made it very clear that doing it suburb to suburb would not necessarily deliver the outcome we want, that postcode boundaries, however inconvenient, I fully accept the point you make, but that was the best way to go. Whenever you draw a line on a map, there will always be people on either side of it. There will always be anomalies and issues that come from that. What I would say though, the alternative is to say, let's take the broadest brush we can and lock down the entire north or west of the city, or even further still, let's lock down the entirety of metropolitan Melbourne. We don't think that is a proportionate response. This is where the problem is, and the data doesn't lie. This is where the problem is, and these are the steps that the public health team deem appropriate to pull this thing up.
We've been asking you questions about problems with hotel quarantine now for weeks. Why has it taken the government so long to address them, and I guess even acknowledge that there was a problem?
No, I wouldn't say that was an accurate characterisation of the government's response, Lundy. There's been a number of changes made in hotel quarantine over a lengthy period of time. Yesterday I made it clear to you that some of the behaviour, we believe that we've remedied that, and that was remedied some time ago. I spoke to you on the weekend. I've spoken at many different occasions about, and so has the Chief Health Officer, about different reviews, different changes to practices. The key point yesterday was that for the first time we had the most comprehensive genomic sequencing report that I've certainly been briefed on throughout the entire pandemic. That left me in no doubt that if not right now, but certainly back weeks and weeks ago, there was a significant infection control problem. And on that basis, the inquiry's been announced. I'll update you as soon as I can in relation to the terms of reference and the retired judge who will be performing that role. And out of a complete abundance of caution, I made a request to the Prime Minister to have flights that would have arrived here over the next 2 weeks be sent to other capital cities. I have thanked the premiers of the states where it is logical where those flights will go, principally New South Wales and Queensland, for them playing that role. That is purely through an abundance of caution. In the meantime, the people who run our jails, the Corrections Victoria staff, are playing a much bigger role in that space, and I think that's appropriate. They've got, without any question, the best experience to be able to do that.
You rejected the calls for independent oversight though a few weeks ago, and instead gave PAEC the job of overseeing the government's response. Do you think, had you accepted those calls for some sort of independent oversight, that these problems might have been identified and acted on earlier than they have been?
No, I don't think that's right at all. The genomic sequencing report arrived yesterday, and the Chief Health Officer made it very clear to us the results of that genomic sequencing, and we've acted without a moment's delay. We received it yesterday morning, and we've made some decisions the afternoon of the same day.
The issues around the hotels, as Lundy's pointed out, were raised weeks ago. So it's not really fair to say that it just came up yesterday because of genomic sequencing. The issues were raised weeks ago, isn't there? Can't you just admit that this was a problem some time ago?
Well, Rich, I think that's exactly what I've done. I don't think there's any debate between your questions and my answer. Be really clear about this. There have been unacceptable infection control breaches in hotel quarantine. That is unacceptable to me and to all Victorians. That's why we have cancelled those flights that would have come here through an abundance of caution. It's why there's been changes made in the way hotel quarantine operates, and it's why we're going to have an inquiry to determine exactly what has gone on here. I don't think there's any dispute between what you're putting to me and the actions that I've taken.
Which companies are responsible for overseeing security in hotel quarantine?
I'd need to come back to you in terms of a list. There are a number of different players, and some of them that were involved in early stages were not involved for very long, and they're not involved now. I'm happy to try and come back to you with some further details of that.
I put those questions to your office last week, and they wouldn't name the companies. Why won't they name them?
Again, I can only take your request. You didn't make that request to me, Rachel. I'll be happy to follow that up. I'm not sure whether there are commercial issues, whether they're contract terms, I'm not sure, but whatever information we can get to you, we will.
What was the tender process for appointing those companies?
Again, all of those matters will be the subject of the inquiry that will be run. That's appropriate. I'm not going to be running that inquiry, and none of us are. A former judge is going to do that work, and I think that's the most appropriate thing. Be in no doubt These are unacceptable breaches, but that's happened. That has occurred. We can't change that. We can only try and understand exactly what the nature of that is. What we're doing now and what we're exclusively focused on is making sure that we deal with the challenge that has presented to us, and that is at least a significant number of these new cases can be traced back to those breaches. Now we have to take the action that's critically important to get some stability back in these numbers, to again assert control over this virus and to drive those case numbers down. That's what we're exclusively focused on. The former judge, that person will be exclusively focused on doing a proper review, and we'll wait and see what the findings are.
There's reports that New South Wales have rejected the request to divert flights from Melbourne.
I certainly haven't seen those reports.
Is that over the cost of hotels? Is that considered?
I haven't seen those reports. I've been having numerous communications with the Premier of New South Wales in recent days, and indeed over many, many weeks. That's certainly not been an issue that's been raised with me.
And just on the judicial review,
Sure.
will that be public?
That'll be a matter for the reviewer as to how.
The report, sorry.
Oh, the report.
Will you make the report public?
It'll be handled in the usual way, so I would expect yes.
Premier, 150 staff from SBS Federation Square office.
Yes, I have seen those reports.
Told to self-isolate
Yep.
for 2 weeks. The company's been told it's due to some changed guidelines surrounding definition of close contacts. I'm just wondering, what are these new guidelines, and what implications could it have for other businesses?
I had got a report just before I came in this morning that there had been a number of staff had been asked to quarantine because they were potentially close contacts of a positive case at the SBS offices. That was put to me, and it was very clear to me when I was informed of that that's potentially a big challenge in terms of getting our message out to multicultural communities. So I was very concerned on that basis. I wasn't aware that there was any change in the way we define close contacts. There are rules there. I'm more than happy to get the Chief Health Officer to come back and follow up with you on that.
Does the Minister know at all if there
I'm not
are
sure.
new guidelines surrounding close contacts that you're aware of?
What we can do is have the Chief Health Officer or one of his deputies come back to you directly.
So New South Wales Health Minister Brad Hazzard, so he's announced some pretty heavy penalties for people who are travelling to and from New South Wales and the hotspot suburbs here. A couple of questions. One, whether or not Victoria would ever consider penalties in order of that same sort of magnitude. So he's talking about, up to $11,000 fines and potentially jail for people who breach these restrictions. So whether those sort of penalties could be applied here. But also the broader question here, they're very targeted. So he's recognising that it's a local outbreak and he's limiting the restrictions to those suburbs. Will you raise with National Cabinet the issue with the Queensland position and South Australian position, and whether or not that needs to be changed so that people who live outside these areas can travel to and from those states?
I think that's a very fair point. I'm not necessarily here today to comment on what decisions that other governments have made. I would say, though, I'm very confident that we're not going to see people travelling out, certainly not travelling interstate for any of the 4 permitted reasons. I think the notion that people will be travelling to other states out of those lockdown postcodes, that is not one of the 4 reasons to leave your home. The only one you could possibly think of might be work, and frankly, that any work arrangements like that should be able to be done at home. So I think to a certain extent, Premier Berejiklian is, I think, comfortable with the fact that we're not going to see people from those hotspot postcodes leaving their home for other than those 4 reasons, and that will be a very heavily policed thing at a local level. And I think that's the most appropriate response. There is, of course, the other issue that the way New South Wales necessarily responds to these challenges in our city and state will always be slightly different because the border remains open with New South Wales. As for other states, they've had border closures for a long time, and I think you probably have to see it in that context. In terms of penalties and whether we might look to change those penalties, I've got no advice that that's necessary. We have 2 different regimes in terms of penalties. There are on-the-spot fines that, in accordance with long-standing practice across the whole statute book, are always less than if you take the matter to court. And if the seriousness of the breach is at that higher level, then those matters would normally go to court. But you can finish up with a fine in and around I think about $10,000, and for businesses it goes up to about $100,000. The on-the-spot numbers are lower. So I think that we've got a penalty framework, and we've certainly got a police force that is completely motivated to be out there making sure that these rules are followed, because we all know and understand how serious it is. And if the rules aren't enforced, then the notion that they'll be followed, well, that will then be a percentage of the community, albeit a high percentage, but it won't be the sort of compliance levels that we need.
But through that national cabinet process,
sure,
don't you need to push back on behalf of the interests of, I mean, you've got 300,000 odd people who live in these suburbs, another 6 million people living in Victoria.
Yes.
They're trying to run businesses,
yep.
some of them tourist operations. So they're paying a cost now for what's going on in this very limited part of the state.
Yep.
You need to push back through national cabinet and say, hang on, we need to get grown up about this, and the restrictions need to reflect the reality of what's actually going on.
Well, and with the greatest of respect, Chip, there are ways to push back. And you might choose to do it at a media conference, or you might choose to do it one-on-one. And I don't often.
Well, you can have a crack at both if you want.
Well, indeed. And I'm certain that you might well invite me to, as you just have, and you might re-invite me on numerous occasions to do that. That's not the way that I operate, and I don't think you get necessarily the best outcomes by doing it that way. Again, other states have made their own judgments. If you want to know what's motivated them, then they're in the position to answer those questions. From my point of view, I've got to say, I'm less concerned about people travelling to and from Queensland. I don't think there's going to be much of that happening. I'm much more concerned on people in those hotspots and all Victorians following the rules, those rules being policed, the testing continuing to be at record and unprecedented levels, the door knocking similarly. Our public health response is what's dominating me day and night, and I think that's exactly the way Victorians would want it to be.
Just school holidays,
yep.
school term goes back in the
yes.
middle of this lockdown period. Yesterday we spoke about some families refusing the test. Can you understand that some parents might be concerned about sending their children back to school in 2 weeks' time in these hotspot areas with kids who haven't been tested?
Look, certainly there is a sense of anxiety, there's a sense of concern. That's very real. There's no point trying to explain that away. That is real. But what I would say to every Victorian, whether they be in these hotspot suburbs and postcodes or outside them, the very clear advice from the Chief Health Officer and the Public Health team is that we have not seen significant or even very much at all transmission between kids and adults. On that basis, not a judgment made by politicians, a judgment made by the health experts, schools can remain open in those hotspot postcodes. I know that does seem a little bit counterintuitive, as many things in this pandemic do, but that is the clear advice. Now, I do hasten to add, if that advice were to change between now and the resumption of the next term, then of course we would move to an alternative set of arrangements, and we would endeavour to give all impacted families and school communities as much notice as possible. But as I stand here now, that is not the advice, and there's no sense that that is unstable and may change. It could, but that's not the position of the public health team at the moment. Of course, the usual protocols around schools, if there is a positive case, if there is an outbreak in a school community, whether that be amongst the student body or amongst the teachers and staff or anybody else associated with that school, then the usual closure, deep clean, all of those processes remain in place, whether the school be in a lockdown postcode or anywhere else in the state.
Premier, for weeks you stood here and told us that you couldn't reopen schools, not because of the issue between transmission between children and adults, but because of the community interaction that schools being open involved. Why has that now changed?
Well, obviously, Rachel, this is not every single Victorian school, which I think from memory is the best part of 1 million students. That I think is the best way to answer your question.
You're still opening them in the hotspot areas?
Well, I was just getting to the second best answer to the question, and that is that the Chief Health Officer isn't advising me to close schools. So I suppose, I could go against that advice. That's not been my practice, and I don't think that would be something that any Victorian would welcome. We took a position statewide at a time when we had instability, community transmission, and rapidly rising case numbers across the whole state, and that was the appropriate decision based on health advice. At the same time, that is not the position. That is not the position now, and therefore we will not be doing that, unless, of course, that advice changes. And I do appreciate that when you act on advice and it's based on data and science, it can change from time to time, and that can throw up some challenges in and of itself. The alternative, of course, is to ignore that advice, and that's not been my practice. I'd also just make the point, even though we have an isolated corridor, albeit a substantial number of families, a substantial number of businesses and a significant land mass, if you like, across the northwestern suburbs, the order to work from home, if you have been working from home, remains in place across the whole state. So there will be different settings that endure. The best endeavours are made to make them as consistent amongst, if you like, between each other and across the board. We always work hard to make sure these things are as consistent as possible. But as you know, this is not about any sort of absolute. It is a series of careful judgments that are made, not to eliminate all risk, but to do those things that are practical, that can drive the risk of any given activity and the aggregate risk across the whole state into an acceptable threshold. That's exactly what we've done here.
Why
don't we go over here and then we'll come back to Jodie. Laurel.
The logistics of how it's going to work with the
Sure.
suburban lockdown, it seems far more complicated because some people are in and some people are out. Had a few specific questions about if you're in a hotspot, are you allowed to go to a gym, for instance, that is still open in an area that's not a hotspot? If you are a couple, are you allowed to go and visit your loved one who is in a hotspot but you're not, that sort of thing? Is there any way we can clear up some confusion?
Yeah, I think the Chief Health Officer was pretty clear yesterday following the media conference that in terms of intimate partners, then that is, I think he's provided some clear advice on that. In terms of daily exercise, I suppose what I'd be asking people to do is do what you need to do. Don't go bushwalking for a day 100 kilometres from where you live. That doesn't make any sense. You don't need to do that. Daily exercise is just as the term implies. You would go out for a walk, a run. You would try and stay as close to home as possible. I suppose, you know, there are infinite numbers of examples and infinite numbers of questions about these things. The best answer to them in the first instance, regardless of the question, is common sense, good judgment. Again, we're always happy to follow up specific issues, and I do readily concede that because this is not statewide, there will be some additional complexities because of the targeted nature of this lockdown. It's targeted because that's where the problem is at its most acute level. The alternative is, of course, to say, OK, well, we'll lock down the whole city or the whole state. That's not the advice I have, and I think that comes with a whole lot of damage that would not be proportionate to the challenge and the risk that we face. So again, good judgment, common sense. There are 4 reasons. It'll be policed. If you're not out and you can't explain yourself, if you're out rather, and you can't explain yourself against those 4 reasons, then you do face the very real risk of being A, caught, and B, fined.
Premier, without trying to split hairs here, but if people
Sure.
who live in these zones but have to work elsewhere,
Yes.
so they come to the city
Yes.
to work, are they restricted in their movements once they're outside the zone? So if someone lives in Broadmeadows and works in the city, are they allowed to go to cafes, restaurants?
Let me go to that directly. Going to a cafe is not one of the 4 reasons to leave your home. So those rules, those 4 reasons, travel with those people, regardless of where they finish up. So let me give you an example. If a staff member in my office who comes from one of those lockdown postcodes, or a staff member who works for a business in the city, say, and they have not been working from home, so the enduring arrangements about work from home, if they didn't apply to them, or perhaps a better example, somebody who is a tradesperson from a lockdown suburb, you can't do that work from home. They are still allowed to go to work if that is absolutely essential, if there's no option for them but to go and work in their workplace. Doesn't mean you can be going to restaurants, doesn't mean you can be going to the pub. That's not part of your work. That is not part of your work. So on that basis, if you can work from home, you should. If that can't happen, then you can go to work and then you should be going home. And the other point to make here, and I'll be very grateful if we can try and get this message out as broadly as possible, if you are from outside the lockdown suburbs, you should only be going into those postcodes and suburbs for one of the 4 reasons, and then only if you have to. I don't think there will be people from one side of Melbourne, say the southeastern suburbs, going over into these lockdown postcodes to buy food or to go shopping. I wouldn't have thought that was something that people needed to do. If you do have to go to work there, and there will be some people who do, again, a bit like the example in reverse, who have to go and work in these postcodes, then you should be going to work and then you should be going home. Caregiving, there will be examples of people where family members and others for whom they have caregiving duties, unless another arrangement can be put in place, then yes, you can go and do caregiving. But again, you need to be aware of the rules and aware of just that common sense principle. Only do it if you have to do it. If you can avoid doing it, if you can avoid moving around these communities, entering these communities, then that's in everybody's interests.
Just a quirky one on that. So with restaurants in the lockdown areas...
Yes, they'll be takeaway only.
Right, and so they'll be relying a lot on food deliveries.
They will.
So the delivery services, is it reasonable for them to move freely in and out of those?
Yeah, I think what we'll do there is get some further advice on that. As you say, it is a quirky one. We'll get some further advice from the Chief Health Officer. I expect... Well, let me not prejudge his advice. Let's get that advice for you, and we'll come back to you.
On this morning's protest in Hawthorn East, will the organisers of that protest be fine?
Well, a couple of points. I was asked this question on radio this morning, and I'll again make it very clear to you, no gatherings of that nature, no gatherings of size should be occurring anywhere, regardless of what motivates them, regardless of the cause or the issue, regardless of the point that is trying to be made, they should not occur. And I'm very pleased to see that I think that my last report is that gathering has now dispersed and is no longer happening. I think there were some attempts to socially distance, but in any event, it is not appropriate to do that. As for fines and penalties, I have made this point a number of times and I'll continue to make it. It's not for me to be issuing fines to people. I don't think that Victorians would be too pleased if we suddenly had a situation where I was the one determining who got fined and who didn't. That is really a matter for Victoria Police.
Premier, yesterday you flagged some possible additional measures for schools like temperature check.
Yes.
Are you in a position to clarify what those are and when?
I'm not, other than to repeat what I said yesterday, and we're having a very close look at that. And again, that'll be based on the best health advice, but we think there are some additional steps we can put in place. And as soon as we've got that finalised, noting, of course, we've got this, well, not quite 2 weeks anymore, a week and a half before we go back to school, we'll have more to say about that.
Just back to today's figures,
Sure.
people seem quite concerned in particular about the 42 unidentified cases. Is that your main concern, tracing that, where they've got that from?
That's our concern each and every day. Whenever you get data like this, there is an enormous amount of work that has to go into making the phone calls, sending the emails, doing that detailed contact tracing work. Sometimes the index case or the point of origin is not as easily understood as you might like. You've got to delve a bit deeper. That's the work that, as Jenny just indicated, 1,350, 1,400 people going to, I think, 1,600 people, plus a whole lot of support from other states. That's the work that those coronavirus detectives do day and night, and that'll become clearer throughout the day. And I think the usual rhythm of this is a stand-up with as much information as possible at that time, and then there's usually a media release with further facts and figures, details, that come from the public health team. Today will be no different to that.
On the genomic testing data, does
Yes.
that show that there's been different strains of the virus spreading? How can we trace it back to those?
Whilst I'm able to talk about the results, I think it's probably best if I don't pretend to give you detailed answers about how genomic sequencing works. If there's specific questions about that process and strains and variants, then I'm more than happy to get the Chief Health Officer to come back to you.
Do you understand that there could be a more virulent strain here in Victoria than, say, in South Wales?
I don't believe there's any evidence to suggest that.
Should Victorians be bracing for, employers be bracing for the work from home order to be extended, and will support be provided to those businesses in the CBD?
Well, I think you've got to go back to first principles here. The only people that have to work from home are people who were already working from home. So enterprise by enterprise, business by business, people have made arrangements throughout the duration of this pandemic. And no one's asking people who have currently been in the workplace to no longer be in the workplace, that at a statewide level, I mean. And on that basis, businesses have made their own judgments. Now, is that convenient? Almost certainly not. But I think there's been a lot of productive output, and I expect that large parts of the workforce will seek to hang on to more flexible working arrangements once this pandemic is over. I think that this model has been proven in many industries, not all industries, but in many industries, that you can have a more flexible work environment, still get the job done. It won't be every worker every day of the week, but I think there will be a significant number of workers in applicable industries that will spend some part of their work week working from home or working closer to home in hub type arrangements. And in terms of hubs, we'll have more to say about that in due course.
Something totally different. Can I just ask about
Sure.
tax? Where are you in terms of the work that's being done to look at alternatives to stamp duty? I know there's been a bit of cooperation with New South Wales there. They seem to be making a push today.
Lundy, I would make the point that there are many things that are dominating each and every day and night for me, and tax reform is not one of them just at the moment. It's not an unimportant issue. I've made some comments about my sincere hope that for the first time in a long time and perhaps ever, the National Cabinet process, a forum that is united and unique, is a platform for us to do some really significant reform work, and that'll range across many different areas. It won't just be about tax. It'll be in lots of different areas. I think we're all accustomed to the usual tax debate that doesn't go very far. I'm quite confident that we can have some discussions about everything from red tape to skills to more infrastructure getting built faster, all the way through to other big drivers of economic efficiency and therefore jobs. I'm sure we can get this done. National Cabinet provides a unique opportunity to do that.
And just to clarify on partners, can people who live outside the hotspots visit their partners in the hotspot postcodes and vice versa?
Yes, I think the Chief Health Officer provided that clarification yesterday.
Just another one on the Queensland relationship. So the Queensland
Sure.
Labor Party
Yes.
today has put out an ad saying that had they not closed the border, you would have had Victorians flooding into Queensland. Now that's a very specific phrase. Do you take offence at that sort of language?
Oh, look, this is not about my feelings, Chip. This is about getting the job done. And we've got the...
Victorians' feelings are hurt. I mean, it's not just you.
Well, are they?
There seems
Are
to
they?
be a
Well,
real
are they? Look,
Well, either makes
in my judgment,
locusts or cane toads or something.
in my judgment, see, I kind of invited this, didn't I, earlier? In my judgment, Victorians are far more concerned about following the rules, getting tested, doing the right thing to get control of this, than worrying about what might be said, albeit colourfully, in other states. That's not something I think that is dominating the thinking and the concern and some of the anxiety we heard about earlier on. You know, this is a very serious matter, and I'm not really spending a lot of time following what other states might have to say about it. We're not commentators on this, we're in the middle of it, and we've all got to work together to get the job done, and I'm confident we have the team and the plan and the will to get this back under control.
Are you embarrassed about having a situation where no other state wants Victorians to go across their borders?
I think I've just answered that.
Is it your understanding that some AFL players who live in these hotspot suburbs might not be able to play?
Well, no, that's not my understanding. I'm happy to get that followed up. This is complex in some respects, but actually quite simple when you think about it. If you're a professional athlete, then it is your work, and work is one of the 4 reasons for which you can leave your home. The AFL and other codes have very detailed and rigorous processes that have been the subject of a very important collaborative partnership between our public health team and those codes. Any specifics on that, I'm more than happy to have them come back to you.
And can you just reiterate what you're expecting people to do from midnight tonight? And I guess, you know, if they don't, will there be a need for...
Well, I am asking all Victorians, whether they be in lockdown postcodes or indeed right across Victoria, if you're sick, get tested. If you're sick, don't go and visit friends. Don't go about your business pretending that you are not sick. All that does is potentially spread the virus. For those families and businesses, those communities that will be locked down from midnight tonight, we know and understand that this is a very significant step. And I simply ask all of those families, follow the rules. They are important rules. This is not a step that's taken lightly, but it is the appropriate public health response in order to get control of this virus again. If we all work together, if we all follow the rules, then we will beat this, and we will be able to bring some stability to those hotspots, drive down case numbers, and then resume our program of cautious easing, opening up. That's where we want to get to, and the public health experts are confident that these measures, provided people comply with the rules and do the right thing, can get us that outcome.
Just going back very quickly to the genomic sequencing,
yes.
Did it show that the current cases we're seeing are all linked back to the hotel quarantine breaches, or are there other sources?
No, I think, as was noted yesterday, both by myself and the Chief Health Officer, there is at least a significant number of these new cases in that northwestern corridor that are, via that genomic sequencing, attributable to breakdowns in infection control. That's what we said yesterday, and I've certainly had no advice to the contrary.
Thanks, everyone.
Any other issues? Very good, thanks a lot.